I've had a lot of my guy friends ask me, why is egg donation so much more intricate, and why is the compensation for egg donors more, and why do egg donors get so much more attention than sperm donors? And I'm like, because dude, the process for donating is totally different. I get the question a lot, is it painful to donate eggs? Well, let's talk about it. Hello, I'm Corlandos Scott, and I'm an assisted reproductive technologies attorney in Los Angeles. And that simply means that I help people grow their family through things like egg donation. So in this episode, we're going to talk about the process of egg donation, the common side effects of egg donation, and safety and risks of egg donation. Let's jump in. So egg donation has become pretty common in today's society, and it's so common that somebody might think that it must be really easy. But is it? I mean, is egg donation similar to sperm donation? Well, as I've discussed in previous videos, the process for sperm donation and egg donation are totally different. I guess the process leading up to the donation is similar, but the actual donation itself is pretty different. Before I dive into whether it's painful to donate eggs, let me just be completely honest with you. It may come as a surprise, but I don't have eggs myself to donate. Not like what we're talking about, at least. No. So I won't be talking from experience, but I will tell you what I've learned from representing hundreds and hundreds of egg donors. So is egg donation painful? Well, I think the answer is yes and no, and maybe so. Well, there's two main procedures involved in egg donation, which result in potential side effects and risks. Let's first talk about injectable stimulating medications. The process for preparing for an egg donation involves being stimulated hormonally through injections most times. And these injections are typically taken without much discomfort, but every person is different, and somebody might not like needles. So if you're an egg donor, you're anything like me, the injections might not be your favorite part of the process. There are donors who have reported experiencing pain, redness, some minor bruising, especially at the injection site. And there's other donors who have allergic reactions, even though that's kind of rare. You definitely, if you're looking towards egg donation, you want to make sure that you stay in constant contact with your doctor or the reproductive endocrinologist. And we call this monitoring. Donors are definitely monitored throughout that injectable stimulation period. And if you're a first-time donor, you definitely want to make sure you stick to your monitoring schedule. Also, we have to keep in mind that when you're given these medications, there is a small risk of developing ovarian hyperstimulation syndrome, or OHSS, during this egg donation cycle. Now, if this is going to happen, it usually occurs after the egg retrieval. When this issue is present, the ovaries are enlarged and there's a significant increase in fluid retention and the concentration of the blood within the blood vessels. Now, in its mild form, at most, it creates a discomfort. It makes you uncomfortable, and it typically resolves itself within several days. But severe form occurs in about, I'd say, 1% of donor cycles. And in its most severe form, which can occur in about 1% of donor cycles, there can be major complications that arise from it. Now, that's the injectable stimulating med phase that leads up to the actual retrieval, or aspiration as it's called. Now, the retrieval itself, I think that would be more towards the no side of is it painful? And the reason I say that is because for most donors, the egg donation process itself is done under sedation. So donors will not experience any pain during the procedure because they'll be out of it, so to speak. Now, after the procedure, some reported a general feeling of tiredness due to the effect of being sedated. So again, after post-procedure, it mostly leans towards the yes. Another reason why it may lean towards the yes post-operation is some donors may experience bleeding or get cramps, but both usually go away the following day, and others, though, have reported that it lasts up to a week. So again, make sure that you're in constant contact for monitoring both during and immediately after your egg retrieval. Now, outside of that, whether it will be painful, yes or no, will really depend on whether you followed the instructions of your doctor, whether you're in constant contact again with your doctor, and just because you're monitoring your body and how your body is responding to the medications and to the procedure. If you like this video, let YouTube know. Go ahead and click the like button, and while you're down there, just subscribe and hit the little bell right beside it so you get alerts whenever I release a new video. So one of the things that I was so curious about, again, not having eggs of my own, when I talked to my reproductive endocrinologist friends, was what happens to your body when you donate eggs? Well, this is how they described it. You get a feeling of fullness, which some people describe as bloating, and that's because, according to doctors, the ovaries are enlarged and at their largest right before the egg retrieval. They say that you can also experience cramping, which is, as they say, somewhat of a rare occurrence, which makes it even more important to mention it to your doctor if it happens to you. There's also weight gain. There can be distended abdomen, discomfort when going to the restroom, or difficulty urinating. Some people have experienced shortness of breath. Some donors have experienced nausea and even vomiting. So the question becomes, how can you prevent or avoid any complications? Well, let's finish there. The number one way to prevent complications or avoid complications in my book is to follow the doctor's instructions. It becomes so important to take the medications, the injections, even the birth control leading up to the medical regimen according to the clinic's guidelines. Also, make sure that you stay in constant communication with your clinic and with your nurse coordinator and even the RE if there are any issues. You always want to make sure that during this monitoring process, you're being monitored and you're getting your questions answered. Thirdly, ask questions. This is your body. This is your future. You only get one. So if you do have any questions about the process, make sure that you ask them. I guarantee you in every egg donation contract, there's going to be a line that says, she understands all of the risks associated with egg donation. So if you're going to be signing a contract that says you understand the risks, make sure you're asking questions beforehand about what those risks could be. Also, make sure that you stay fit. I mean, don't overdo it. Most donors who qualify for being an egg donor are physically fit. But while you're in the process of donating, when you're undergoing the meds and when you're preparing for it, most clinics advise donors to avoid any kind of vigorous exercise or any activities like that during that cycle. So why avoid exercise like that? Well, it's believed that the movements may cause the ovaries to twist because of their heaviness. And that could lead to anything from ovarian hyperstimulation to even a loss of an ovary. So again, follow the doctor's instructions, even when it comes down to activity or giving up some activities. So generally speaking, egg donation is relatively safe. Just look at how popular it's become in the recent past. But like any medical procedure, there are risks. So the question of, is it worth it? The answer, I believe, is yes. Egg donation is one of the most wonderful gifts that any woman can give to a potential parent or a hopeful parent that's looking to grow their family. But when you're going through the process, make sure you're locked into your medical professionals and following their advice. See you in the next episode.